Hello, everyone, and welcome back to What After Dentistry. Sometime back, we covered the scope of forensic odontology after completing MDS in oral pathology. In today's video, we're going to understand the prospects of pursuing a Master of Science in forensic odontology after BDS. And to discuss this, we have with us Dr. Debesh, an avid researcher, dental practitioner, blogger, and academician. He completed his BDS from Haldia Institute of Dental Sciences and Research, West Bengal, and then pursued a Master of Science in Forensic Odontology from National Forensic Sciences University, Gujarat. He has a keen interest in forensic odontology and radiology, and to keep abreast with his passion, he is currently pursuing PhD in the Department of Oral Medicine and Radiology from K.M. Shah Dental College and Hospital, Vadodara. Dr. Debesh is also a proud co founder and co owner of Neve Dental and Wellness Clinic, Vadodara. He has 6 publications to his name in Scopus and PubMed Index journals so far. His key areas of interest lies in forensic facial approximation, age estimation, biostatistics, radiology, and implantology. We know that at this moment, the field of forensic odontology is still unexplored and is beginning to take some shape. So let's understand from Dr. Debesh, how can you have a fruitful career in this field? Hi, Dr. Debesh. Welcome you to our channel, What After Dentistry, to talk about the scope and opportunities in the field of forensic odontology after BDS. So, welcome you once again.
Thank you, ma'am. The honor is all mine. Thanks for the opportunity.
So, before we get into the formal questions and the formal details about this particular career path, I would like to know, how did you develop your interest towards forensic odontology?
It's actually quite funny because I always try my best to be the only lone person on a completely different path. That is something with which even my family is quite annoyed a bit. But I have always tried my best to do that. And when I completed my BDS, like everybody else, I opted to first try and develop my practice and then go further for higher studies. So for the first few years, I was in Kolkata itself. I was practicing, but after a point of time, I was finding it to be too hectic for me. Like I used to live alone. I used to leave for work by 7 o'clock or 8 and return back again at around 10 o'clock. And I used to sit in various clinics, and I think I should thank them that they helped me with the opportunities. I went all around the city, and you already know how big is Kolkata. After a point of time, I used to read blogs and articles, and there, for the first time, I heard about forensic odontology. And next, when I developed the interest, it was during one of the conference proceedings when somebody presented about the subject. So I started searching about it, and once I found the places, I think I contacted one of my faculties who later on turned out to be my PG guide as well, Dr. Abraham Johnson, who gave me a complete idea of what the subject is and what we can do later on. And from there, I think I've never stopped. I've just kept looking here and there, and I'm still working my path through it. Hopefully, I'll reach in a better place.
That's good. That's interesting to know. So, what are the various courses like now when you said you did a research on the courses availability in India? What are the various courses that are available in this career?
Well, to inform you, first of all, forensic odontology still as a subject has a lot to grow, and the courses are there, but very few of them are recognized by the Dental Council of India. Most of them are UGC recognized. That is the problem. So, and there were many fellowship courses during my time. DY Patil University used to conduct one, Savita Dental College used to conduct one. There were also many more private institutes which were doing it. And among the two which gave us master's degree in India was Gujarat Forensic Sciences University, which is now National Forensic Sciences University, and JSS University, Mysore. And I realized I think Gujarat would have been closer to me,
Hmm.
and that is why I decided to opt for Gujarat itself.
Okay, okay. So basically, you did the
These are
master.
the two colleges, and I think currently, yes, ma'am. Currently, I think, sorry for the interruption.
No, no.
Currently, I think the Dental Council of India has also scrapped out all the fellowship programs.
Okay,
So, the safest option in our country for forensic odontology with a good master's degree will either be under National Forensic Sciences University or JSS University, Mysore. Apart from that, there are two very nice certificate courses. One which is conducted by the Maulana Azad Dental College, and the other by SDM College, Dharwar. I think the pioneer or one of the big names in forensic odontology, Dr. Asita Acharya, he's there in Dharwar and he conducts the course there. It is a great place to learn.
okay. Good to
Those
know.
are those certificate courses. They will be over by, I think, 6 months or so.
Okay. I think that's good to know. So I just wanted to understand, like, if one does MDS in oral pathology, they can also get into forensic odontology, right? So I can you explain the difference between pursuing MDS in oral path and Master of Science in Forensic? Which one is better and why?
Actually, I would not comment regarding which one is better. It's like comparing apples to oranges. Uh, I would like to say that actually it's quite funny that there have been many branches which have tried to claim kind of an ownership for forensic odontology. The oral path people say that no, it's our subject. The radiologists say no, it's our subject. It's a quite confused state. But I think overall, the way I studied, I've learned that forensic odontology involves dentistry all in all. So, if we go and opt for an MDS in oral pathology, we'll become a good oral pathologist and we can also know about forensic odontology. But if we want to know the subject in depth, I think it's better to go for an MSc rather than an MDS. If we see practically, maybe oral pathologists have got better job opportunities than us, but not trying to offend anybody. I think going for an MSc in forensic odontology gives us a greater depth about the subject, and oral pathology tells us about the subject, but it need not be the only way to learn forensic odontology.
Okay, okay, I think that's fair enough. And there's also, when you talk about Gujarat University or the National Forensics University, which you mentioned, they also offer a course in Master of Science in Forensic Science, right?
Yes, ma'am.
So, what is the difference between forensic odontology and forensic science? Like, which one is better option or a better pathway for a dental graduate?
Actually, in forensic science, it is a vast ocean.
Okay.
It has got various core areas like fingerprints, DNA, anthropology, question documents, and it has got various other branches as well.
Hmm.
We learn about forensic toxicology, forensic anthropology, a bit of forensic medicine, to be honest. We learn about question documents, we learn about DNA. It's too many things to learn. As To be very exact, forensic odontology is an allied branch of forensic science. As dentists, we can't expect that we'll directly plunge into a crime scene and work there. It's more of a consultatory basis, and only in cases where there might be dental evidences involved, maybe then a forensic odontologist can come into the picture. But a forensic science, if we see in a practical aspect from a crime scene's perspective, a forensic science expert is always needed.
Correct.
So if we go for a Venn diagram, forensic odontology is a very small circle inside the big circle of forensic science.
Correct. Correct. Absolutely. So, if I want to pursue, say, this course outside India, which countries or colleges are you aware of which, any dental graduate can pursue?
Actually, there are a few colleges,
Okay.
like the University of Adelaide provides a graduate diploma in forensic odontology. It's a very detailed course with a lot of practical experiences. That's in Australia. In Belgium, there is KU University Leuven, and that provides us with a forensic odontology M.Sc degree. And the good thing is that if we go there for an M.Sc degree and we have made a dissertation which is good enough, we can further that dissertation topic into a PhD program. They have that provision. Apart from that, there is a MFO Don't degree, Masters in Forensic Odontology, under the Center of Identification in University of Dundee, Scotland. These three, I feel, are the top universities. Apart from that, there are fellowship universities under various universities in USA, but it needs to be ABFO certified. The American Board of Forensic Odontology, they conduct few fellowship courses which are also good enough. And in depth study, I think Scotland, Australia, Adelaide, and Leuven, Belgium are the best ones.
Okay, that's good enough to know. So all you audience, I hope now by now you understood the difference between forensic science and forensic odontology, which colleges are, providing this course, master course in India and outside India. So as he mentioned very correctly, like MDS in oral path will give you in-depth knowledge of oral pathology. Yes, there is a part of forensic odontology, but if you want to know the subject in depth, then Master of Science in Forensic Odontology is a better option to go for. So, moving ahead, Dr. Debesh, we want to know, like, suppose now when I join any course in this particular area, right? Say I go with certificate courses, like you said, it is provided in SDM Dharwad and then Maulana Azad also. Which one will have a better opportunity for me? Like if I pursue a certificate of 6 months as compared to a master's course, which is of 2 years, of course, which will have give me a better job opportunity?
Honestly, regarding job opportunities, forensic odontology is a tough track. Um, it has just reached nascency from obscurity in our country. So we are slowly working our path upwards. But as I said earlier, it is more of a consultatory job. Like we can't just sit and pray that Lord, please let there be a plane crash or that there is disaster, and we as forensic odontologists can go there and identify victims. That is not possible for us. And yeah, I think currently for the growth of the subject, every dentist should know the subject, at least a bit of it, because it is an all in all job, whether we are practicing, whether we are not, because it's a very important thing that a forensic odontologist can also bridge the gap between a doctor and a lawyer in case of malpractice suits. So I feel every general dental practitioner should also know that. For them, considering they have a practice going on, considering they are into a job, going for a certificate course of 6 months, which is also kind of part time because they call us. Mostly there are study materials given, we read, and then during training times, they call us, they give us practical exposure there. So that way, it will be more feasible for them. As a student, if you are just a dental graduate, I think you have nothing to lose if you pursue the subject. As far as jobs are concerned, once we go with an in-depth subject, I don't know about others, but from my own experience, I can say we can identify where all we can be handy, we can be useful as doctors, as dentists. So that is how we can look for jobs. I can't promise whether they will be good paying or not, but it will be a good experience. If you ask me, I started working first in a third party insurance company. I used to be an investigator there, then I became a medical officer. I used to examine uh, medical files, hospitalization files of patients, and try to determine whether the files are genuine or not. Like sometimes there might be everything in medicine and dentistry has a bit of forensic in it. If we can understand that whether through the flow of handwriting, that whether a document has been filled in rush on a day or whether it was filled regularly throughout the hospitalization period. So through those insights and through those observations, we can make ourselves handy at various situations. As far as a research background is concerned, forensic odontology has got a good amount of work there. Anybody can go and work in a research field in forensic odontology. I currently am working as a researcher in Cambridgeshire Dental College. Pursuing my PhD there, but I'm doing my research work there. So that way we can work. But we can't expect for a full time a job where every day we'll find bite marks, every day we'll find patients who need age estimation. So it's from job perspective, it is currently a bit challenging. I won't lie, but yeah, the future is bright. We can slowly and gradually uh, establish ourselves, and I think in the near future we might get chance as good academicians who can train other people, other dentists, other dental students, and this way, if the subject is going to grow, that I think we are going to grow along with it.
Correct, correct,
One of my guides used to say that if you don't give provide anything to the subject is not going to provide you with anything. So
true.
I think currently we are in the phase where we are providing the subject. Hopefully, I think we'll get our returns back. We'll get our due.
Correct, absolutely correct. So you also answered one of my questions wherein, when you heard about, when anyone, I think when we hear about forensic science or forensic odontology, the first and foremost thing that comes into our mind is, oh, it's the kind of job roles that we are going to get is something related to crime investigation. So that's one area. Yes, you said, like, as per need basis, if it is required, they might call an forensic odontology. Apart from that, one can get into research, like you said. One can also get into the fact that, tomorrow, if this once the subject grows, one can work as an academician, right? So these are some of the pathways. Are there any other pathways that one can, how can they integrate this
It's
learnings?
completely to the perspective of the doctors. Like I said, I first started working in the insurance field. I think there also doctors have a good amount of role in investigating insurance frauds, which is quite common in our country. Apart from that, I have seen many of my colleagues and seniors who have been working with the police forces. They have been training police personals as well as they have been going to the crime scenes and learning the other fields of forensic, like forensic biology or
Hmm.
forensic serology. They have also tried working in morgues with forensic medicine experts and learning their due from there. And they have done a good job there. Even in my university itself, I don't know whether every year or not, but periodically they get vacancies from directly the Delhi police, where people can join as a junior or senior forensic assistant who can work in the crime scene and then analyze the evidences, make reports. It's a good opportunity for them there.
Correct. So, moving forward, like now, if someone pursue this particular course, what are the factors? What skills will you advise they should command on? Because once they're out from college, they should be well aware of what are the major skills that are required to become a good forensic odontologist.
Yeah. We need to develop an eye for details. We need to develop attention. We need to observe certain things. When I used to practice one of my seniors used to teach me that when a patient is coming to your office, look at him and try to understand whether he will be able to afford for any expensive treatments or any basic treatment should do for him, and accordingly we need to convince them. That is how we used to learn it in dentistry. When it comes to forensics, I think everything can provide us evidences. So there, as a dentist, we need to give a lot of attention to detail, and secondly, we need to be open to all kinds of possibilities. We need to be unbiased. Most of the times, even in our practical sessions when we used to work, we used to find that most of our results used to come false because we were having a thought in our mind that, okay, if this is the patient, let's say I am giving an example. Suppose we were doing age estimation. We were given a radiograph, and based on that OPG, we just saw how many teeth have erupted. Okay, these are the number of teeth. This patient should be of this much age. And then we started calculating. We can't do that with a perspective already at the back of our head. So that will always give us a false result. So we need to be open to ideas, open to possibilities, and be unbiased. And we need to have a good attention to detail. I think these two things can make someone a very good forensic odontologist.
Right. This is really good to know. And what are the
And
factors?
of course, we need to be very. I'm sorry, ma'am.
No, no,
Uh,
please go ahead.
I think I got too excited with the topic.
That's
I
okay.
think we need to be very meticulous in documenting everything. Documents are the key to everything in our world today. So if we can document everything properly, we are going to get definitive results.
Yeah, correct. Absolutely, guys. I think, even now government is also enforcing so much on documentation that every clinician should have the documentation should be actually really good. And one should definitely maintain their patient records, which is still, yeah, like it's like you said, we are still at a very nascent stage. We are still not, maintaining our patient records, especially in clinics, private clinics. That's what I've seen. Yeah. Okay, so moving ahead, like if I have to choose a college between, say, like you said, the four top notch you have already told, but then there are other prime. I'm sure there might be other private institutions which would be providing this particular course. So how do I differentiate? Like, okay, I have to go with this college or this college. Is there any criteria, say, on practical exposure or some kind of industry exposure that is provided in the top notch colleges?
I think in the top-notch colleges, this subject completely relies on practical exposure. Like even I think our juniors have learnt much more than we have done in our college itself because of the exposure that they get. It's not like we need to go for mock visits. We need to go for moot court sessions. We need to actually see how a court proceeding goes forward. Because as an odontologist, we have the possibility to testify there as an expert witness. We need to see various practical things like from an extracted teeth, whether it is of a human or an animal. If human, then a male or female, what can be the age, what can be the ancestry. We need to handle skulls. We need to work on various kinds of scales. So I think from a university perspective, we need to see if these things are added into the curriculum or not. We need to find that whether they are providing us with moot court sessions, whether they are providing us with mock visits, whether we are doing practical examinations, whether we are learning about DNA, because that is also a very important thing. It is quite interesting that teeth are one of the best sources of DNA in case of a mutilated or damaged crime scene area where the body is completely, let's say, burnt, charred, even in those cases. So we need to learn about DNA a lot, and we need to know, we should know how to use certain instruments which can help us, like mass spectroscopy, like PCR machines. All these things help us. So I think wherever these things are available, where the teachers are also that cooperative that they can provide these things on applications by the students, I think those colleges will be the best. Being an alumni from NFSU, I would always have that bias in me to say that, yeah, it is a good place to learn the subject. The faculties are also good. But I think currently JSS Mysore is also doing a very nice job. I have one of my colleagues there, Dr. Swati, and she's doing a fantastic job with the students.
Okay. That's good to know. So all you audience, Dr. Debesh has very clearly, he's listed out all the factors which can help you to choose a college if you want to pursue this course and make a career into this field. So, like we are almost, coming towards the end of the session. I just want to know, like, how do you foresee the future in this field? What are the advancements that you think will be coming up or are happening in the field?
I think currently AI based forensic odontology work is gaining a lot of popularity nowadays. I think from past 3 years they have developed quite exponentially, in my belief. Everything like from dental age estimation to dental autopsy, which is also known as vertopsy nowadays, uh, or dentovertopsy, or even in fields like facial approximation, facial reconstruction. In remains where no data is found about the individual, we only have a skull, we can determine the face and try to identify people. In all these fields, AI is doing a great job.
Okay.
So it is quite confusing that by developing AI in forensic odontology, whether we are looking for better opportunities in the improvement of the field, or we are actually compromising ourselves from job opportunities. But I think various these fields like AI and of course DNA, the DNA extraction from teeth, these two are really developing quite fast. 3D modeling in forensic odontology is something new which is developed, gaining popularity in India. My colleagues, some of them have started working in it, and they are doing a fairly nice job there. So I think with these fields, the subject is going to grow more, and it is going to garner much more interest from the young dental graduates who are coming forward.
Correct, correct.
And I think already many colleges have started to make their own forensic odontology centers in their colleges under the Department of Oral Pathology or under the Department of Oral Medicine and Radiology. They are doing that. And even as per the curriculum, it is said that there should be I think about 10 hours of lectures and practicals in both third year and final year students for forensic odontology. Many colleges have started in implementing that, and students are gaining interest in it very fast.
Yeah, correct, correct. Yes, absolutely correct. So, any last thoughts or advice for the audience that you would like to share?
Well, I'm not that experienced to share any advice. I have so far just shared my experiences. I'll only say that if somebody is deciding onto something, they need to keep their resolution quite tight. I'd like to share a story that when I decided to go for this subject, I just called home and told my father that, Dad, I want to pursue this subject. And he's like, is there any subject like this, or you are just making it up? And then he was like, think about it and then decide. And one day I just told him that, look, currently, no matter how much I think, you are going to pay for it.
Hmm.
So ultimately, it's your decision whether I'll be pursuing the course or not. But ultimately, he agreed. He has supported me so far a lot. My parents have done uh, really, they have supported me a lot. And I think staying in the resolution matters. Had I just told it casually, I think he would have also taken it casually. But I think he saw my seriousness and later on encouraged me with it. And of course, find a good guide. A guide matters. If you have a proper mentor for the subject who can really slowly not only teach you regarding the subject but also groom you by giving you small opportunities as well as large ones. I think everybody can excel, not only in forensic odontology, but I think in any field. A good teacher always matters, and great determination, hard work. There's no shortcut for that. We need to keep it.
Absolutely correct. Yes, absolutely correct. So, all you audience, I hope you understood what Dr. Debesh has been talking about. He has given us so many insights into this field. What are the opportunities available? What factors you should keep in mind if you're selecting any college? The advancements that are happening in this field, and so on and so forth. So, thank you so much, Dr. Debesh, for coming on our channel and talking about this subject, talking about this career, because we have been receiving requests regarding this field also. So thank you so very much for sharing all the insights.
The pleasure is all mine. I think I had been looking for an opportunity to speak to the general public about this. I think not only young dentists, but also even in the uh, common people should know that a dentist is much more than just treating them through their teeth. We can also help them in various other ways. If this thing is known to public and to the mass, I think we are going to definitely excel. I'm always open for any kind of help if it is needed, and I look forward to working more with you. Thank you.
Thank you so much. So, all you audience, thank you so much for patiently listening to us today. If you have any questions related to this field, you can always reach out to Dr. Devesh on his email ID, which I will be sharing in the video description. So, do check that out. Thank you so much once again. I will see you in the next video. And before that, please subscribe to our channel. It's absolutely free. Like and share this in your network because this might help out someone who's looking to get into this field of forensic odontology. So thank you once again. I will see you in the next video. Until then, bye and good luck.